Welcome back to the Morning Blend. When you are not feeling well, you can't live your fullest life.
And too often doctors are rushed and seem to only use prescriptions to cover up your symptoms. Joining us now is Dr. Tiffany Mullen, the CEO and co-founder of Vytal Health, where they're bringing functional medicine into the future. Good to have you here today.
Nice to be here. I'm so excited. Best day to be here.
I know,
all the firefighters.
Hanging out in the back room with the firefighters.
It's true.
I love my job.
Couldn't have had a better day. Couldn't have had a better day. It's true. You know, this is interesting because I think some people are familiar with the term functional medicine, others are not. So how do you describe it to someone what it is and why it's different?
I love to use the analogy of the house plant. Okay. So everyone has had a plant in their house, right? And at some point, the leaves start to turn brown. And you sort of think like, why is this happening? We immediately go to, is the soil not fertilized? Did I overwater? Did I underwater? Do I need to move windows? We don't ever really think about just spray painting the leaves green, right?
Right.
So it's this idea that we can take apart problems and understand the root cause, and that's what functional medicine does, rather than just cover up the problem with just prescriptions. You know, that doesn't make any sense.
I get what you're saying. The spray painting the leaves is sort of like what we often do when we go to the doctor and complain. And I think all the things that people complain about, especially the common blood pressure, cholesterol, reflux and GERD, usually a regular physician seems to just prescribe whatever medication addresses that symptom, rather than, as you're saying, sort of picking it apart and understanding what needs to change to make the person feel better.
I mean, that's the human version of the soil for the plant, the lifestyle, everything that we surround ourselves with, our nutrition, our exercise, our sleep, our stress, all of those things contribute to ultimately how we become healthy or not healthy. And I think that that is what we miss when we're so rushed and we're trying to just get through a 10 to 15 minute office visit. We really don't have the time to sit and counsel a patient or really listen to them about what's going on in their life and how can we make things better without just handing out a bunch of prescriptions.
You worked for a big hospital system and
did.
then you left and you started Vytal Health. Why did you want to do that? Why was it important to kind of break off and do your own thing?
I have been a patient my entire life. I started off life with a childhood chronic illness, and I still have that illness. And so that was really my motivation for becoming a physician in the first place, was that I just very optimistically entered into healthcare thinking, okay, I can do this better. I can make patients have a better experience and all of these things. So I get into healthcare, and I've been a physician for 20 years. And what I realized was the system is really stacked against both physicians and patients. The rushed nature of a physician trying to see a patient every 15 minutes and patients feeling like they have a lot to address in that 15-minute visit and they really can't get through it. It just ends up shortchanging the entire equation. And I just watched my colleagues burn out. I was burnt out at some point, and I just felt like we can't be effective when we're doing things this way. So that's why we decided to found Vytal Health, which really takes the time to unpack those problems. And we do it in a super convenient way. We do it via video, like Skype or FaceTime. And we deliver our care to patients in their homes, because who wants to get out in yesterday's weather and try to schlep through all the fall leaves and the snow and everything that's happening out there? Hire a babysitter, tell your boss I'm leaving work, I'm not sure when I'll be back, depending on whether the doctor's running on time, sit in the waiting room for endless hours, you know, that kind of experience.
So you skip all that.
Skip all that. We come to you.
So who should see you? Because I wonder, a lot of people are going to go, well, I'm not sick, I don't know if I need this. Or some people are going to say, I have a very advanced situation and already being treated. And do people see you almost as if they would a primary care physician?
Typically not a primary care physician. So a lot of our patients are not feeling well, and they typically have problems that are not addressed in that very rapid office visit. So they would come into the office and maybe they've seen a physician, or maybe they've seen 4 or 5 physicians, and they just keep getting dismissed. I've heard more patients say, I was made to feel as though there was something wrong with me and that I was crazy, and I just know something's wrong. Those are typically the patients that we see. Or I have a problem and my doctor just won't listen to my ideas about how to approach it. So we want to collaborate with patients in that way.
What are some of the specialties that you address? Because we're looking at thyroid, different things like that there.
Yeah, so this is a very traditional versus the way we unpack things. So I think what we have up on the camera is actually a hormone
Yes.
slide. So when a woman is having some menstrual irregularities or when she is having problems with fertility perhaps, we do a 21-day estrogen and progesterone in a traditional office visit. That's just a snapshot. In functional medicine, on the bottom of the screen, you see we actually do a home-based urine test. All of our tests are done at home.
Yeah.
Taking a urine sample every other day so that we can plot out the menstrual cycle over an entire month and really understand what's happening every day of the woman's cycle, not just on one day of that cycle. And then that really helps us pinpoint it.
A lot more information.
A lot of information.
And especially the in-depth is a genomics test. Traditional doctors really don't do that type of testing to get to the root cause very often. And that's another example of the type of testing you do to really get to the source of the problem so that you not just help mask the symptoms, but even correct or cure the problem.
Functional medicine physicians in general are incredibly curious. We want to go deep and understand what's happening. And so, yeah, we use tests that are done at home. We can take genomics, we can layer that on with other types of tests, and pretty soon this very strong picture of what might be going on emerges from that information. So it's incredibly insightful, and patients are thrilled when they are able to get that information.
It's fantastic. We just got a live look at your website, which was fun. You can take a symptom quiz, which is a fun way to start if you're not familiar with functional medicine. You can go to Vytal Health. Make sure you check the spelling there because it's VYTAL Health.com. You can also call for more information about how the visit works at 855-998-4900. Great to meet you.
Nice to meet you as
Appreciate your time
well.
today.
Thank you so much.
Great.
Thank you so
Loved
much.
it.
Absolutely.